Hi, welcome to Nursing Manthra. Today's video is an informative video, tips for your nursing interview. As we know that for getting job in a good facility is too difficult. As a nurse, you must prepare to attend any kind of interview. I know that you are familiar with your department experience related questions. Example, if you are in an ICU nurse, then they will ask about ventilator care settings, bundles, then ECMO care and emergency medications like that. For an emergency department nurse, emergency medications, ABG analysis, emergency care given for MI, stroke, hypoglycemia, DKA, then infection control practice, and so many other questions they can ask. So you must have thorough knowledge about the infection control practices, JCI guidelines, IPSG goals, then PP usage, emergency medications, and the care related to your department. For me, I think I attended my first interview in a hospital in Bangalore. The interviewer was emergency department physician. The question was all about emergency medications, management, emergency care, ECG, and so many other questions related to the emergency department. Soon after my studies, to answer all these kind of questions was difficult for me. Somehow I managed with whatever I studied from the books I have answered. Then I got selected and started the career in that hospital. Later on in the lecture field with the different types of questions were there for an interview. Then when I moved to Saudi Arabia, I attended interview from India. In that they were asked about DKA, MI management and some other topics which I forgot. Okay. So once reaching in the Saudi Arabia, again there was one interview in the main hospital. They asked me about ABG related questions, metabolic acidosis, alkalosis, then Allen's test, emergency medications and its management, contraindications, like that questions they have asked. So here I am going to give you some tips to follow when you present for an interview. Arriving in a professional outfit help you to feel more confident and has the potential to make you stand out against other candidates. Consider wearing a tailored and soiled colored suit for your nursing interview. You should not use a scrub suit for a nursing interview. Scrub suit must wear during your patient care, not for an interview. Even though if it is matching more to you, you should not wear the scrub suit. A button-down dress shirt or a conservative top is appropriate for most of the occasions. No matter the top you choose, make sure it is wrinkle-free and stain-free. Okay, so better to use light-colored like baby pink, white color, light blue, peach color shirts. Pair a nice top with a pair of black or navy slacks or dress pants like that. Make sure you have ironed and if you are wearing a button-down shirt, tuck it into your pants for a polished look. And do it based on your body structure. Avoid the tight leggings, jeans, churidar like that. Opt for low-heeled shoes, flat or dress shoes that match your outfit. Make sure they are properly cleaned and polished. If you decided to wear jewelry, keep it to a minimum, such as a small pair of earrings and a simple necklace, matching necklace. The more advanced the position you are seeking, the more professional attire you should wear. While you can wear the dress, slacks and a button-down shirt for a nursing interview, it is best to opt for a suit when interviewing for a nursing management position to show a higher level of professionalism. Apart from wearing a professional outfit, make sure to consider proper hygiene and grooming. Consider getting a haircut, fixing your hair appropriately, then trimming your nails and ironing your clothes. Opt for natural light colors as nail polish. Then just use your normal makeup routine to look presentable and polished. Lipstick, eyeliner, face cream like that. Once your outfit is ready, then the best way to prepare for a nursing interview is to read the job description and make sure you prepare answers to all possible interview questions that could come from it. Now I will discuss how to answer nursing interview questions. Each person will have different concepts and points to discuss. More than me, you maybe answer the questions. And all interviewers will not ask all the questions. But if the interview is conducted by your HR department or the nursing director, you can expect like these questions for an interview. As I told, your interviewer is in department in charge. They likes to ask about the procedure and care related to their department. But this video I specially made for the nurses who don't know to answer the basic interview questions. The first question, that is, tell me about yourself. Good morning. Thank you for taking your time to see me in person. I really appreciate it. My name is Shinsi George, MSc Nursing graduate specialized in critical care nursing from India. I grew up in India and moved to UAE few years ago. I have worked in a variety of nursing positions and gained considerable experience as a registered nurse, team lead, nursing lecturer in various countries like India, Saudi Arabia and UAE. I possess over 10 years of experience in these areas. I possess authorship of 8 books related to the nursing and which is circulated in the nursing colleges in India. I have applied with your hospital because I strongly believe I have the skills, qualities and the experience to perform to a very high standard and to meet the expectations of the job description given. I have excellent communication skills. I am compassionate. I enjoy providing outstanding care and treatment that is focused on the patient's needs. I enjoy team working. I am so enthusiastic and energetic person who loves learning new technology related to the nursing care. So you can tell about your experience field and your extra talents. Always by heart this, introduce yourself to avoid rejection by the employer. Okay. So next question, what are the 6 C's in the nursing care? The 6 C's in the nursing care, that is care, compassion, courage, communication, commitment and competence. The important one is in this, I consider it for competence. If you are competent enough, other all C's will come automatically. Next question, why you selected our hospital to work as a nurse? I want to work for your hospital primarily because of the values you expect all staff to demonstrate in their work. And in fact that I have heard nothing but positive things about the way the senior management team run the hospital, or if it is a medical center, run the medical center. Prior to applying to become a nurse here, I studied the values and I like the fact that everything you do is centered on providing first-class treatment and care, on ensuring respect and dignity is instilled in everyone's working practice, and the fact that everyone counts. The values means a lot to me because I feel I will be respected in my nursing roles. I will have a resource to do my job properly, and I will feel that I am a part of a wider healthcare team that cares and that are all pulling in the same direction. You must be careful. Some interviewers, they can ask about values and goal of that hospital where you are going. So you must read through the values and all before attending an interview. Through their website it will be there. Okay, for my personal experience, 3 hospitals where I had done the interview asked me this question: what is this hospital values, like that they have asked. Okay, so next question, what are your strengths? So you can answer, I have numerous strengths that enable me to a competent and trustworthy nurse. First and foremost, I have a good depth of knowledge in respect of how to assess, diagnose and treat patient in terms of the nursing care. I am a good team worker and I will ensure the highest standard of treatment and care. I am resilient, confident and can work well under pressure. I am quiet learner. I also take great pride in doing my job as a nurse to a high standard, which means I will always take responsibility for my own professional development. Finally, other strengths include my kindness, my positivity, and the natural levels of compassion I apply within my work while caring for patient. Next question, what is your biggest weakness? Really, this question makes us little tensed what we have to tell here like that. I feel my main weakness is that sometimes takes on too much work simply because I don't want to say no to anyone. By taking on too much work, it can potentially having a detrimental impact on my other task. So I am learning to complete the task thoroughly first before agreeing to take additional tasks. Having said that, I do feel it would be my responsibility to take on all such works as possible while working this nursing role. And I can be relied upon to work hard and provide the right level of the care thoroughly. If I feel there is a task put my way that I cannot deliver on time and to the right standard, I will always book to find someone else within the team who is equally as competent to task on the role. Finally, I am always looking to personally develop and improve my skills based on reflective analysis of my performance. Next question is, what has attracted you to nursing? I was attracted to nursing primarily because I am someone who enjoys the responsibility. Being a nurse require you to may adapt to so many different situations, dealing with the different nationalities, different individual characters, different cultures like that. You must be compassionate and show empathy at all times. Alter your style of communication to meet the needs of the patient, and also make sure the treatment and care you provide is to high standard and in line with the nursing guidelines and the values expected from your employer. Being a nurse make me feel proud because I get to make a positive difference to people's lives every day, whether that is providing appropriate treatment and care, providing educational advice to the people, lead more responsible and healthier lives. Next question, how would you deal with a difficult or irritated patient? I would be professional at all times while dealing with the patient, and I would not take anything they said personally. The patient may be understandably anxious or worried about their treatment, which can often lead to them being difficult to deal with. I would assess the situation to find the underlying cause of their problem, and I would show that I cared while communicating with them. I would pay attention to what they were saying. I would listen and I would try to make connection with the patient, which should help to improve the situation. At all times, I would remain calm and I would focus on my duties and ensure the treatment and care I provided was first class. Next question. Tell me about a time when you challenged another healthcare professional who was not acting in accordance with policies of your hospital. During a particular shift, I overheard a healthcare worker speaking to a patient in what appeared to be a like a flirty and over a familiar manner. I immediately felt their actions were inappropriate, and so I decided to speak to him in private about my concerns. I explained to him that while I was not accusing him of anything specifically, the conversation I overheard was not commensurate with the values of the hospital or the team, and that I felt he should protect both himself and the patient by communicating and operating in an entirely professional manner at all times. Although he was initially taken aback of my advice, he thanked me for being honest and moving forward. I never heard him communicate with anyone in that style again. As nurses and healthcare workers, we have a duty to act in a professional manner at all times. And it is important we challenge people whenever they fail sort of those standards. So finally, the interviewers will say that this is the end of interview. Do you have any question for the panel? So you can ask the questions, whatever question you want to ask with the panel. The sample answer you can ask like, what is the most common type of treatment and routine procedures of my department? That you can ask. Or what challenges are you facing in the department right now and how can I help to overcome them as a nurse? These questions you can ask. Don't ask about the salary details, all other details and all. Don't ask with the interviewer. That is your HR department, they will deal with that, not by the interviewer. So I hope this video is really helpful to you. If you like, you can just share your comments. Thank you.